The inside of the heart is where we can see the chambers and the valves really well. So we see the right atrium, right ventricle, left atrium, and left ventricle. Remember that the blood is always going to flow from an atria to a ventricle. So this would be the right side of the heart, which is the pulmonary circuit. And the left side of the heart is going to be the systemic circuit. And so the oxygenated blood on the left side of the heart is going to flow from the left atrium to the left ventricle. So not only are there four chambers, but there's also four important valves. And these valves are named by their location. So two of them are located between the atria and the ventricles. They are called the atrioventricular valves. Two of them are located between the ventricles and where they lead to. And they're the base of those great arteries like the pulmonary trunk, as well as the aorta. So the valves closures are going to be responsible for one of the sounds that you could hear with a stethoscope on the heart. So the closure from the first sound is called the lub sound. The second sound is the dup sound. We think of lub, dup. Those sounds that you hear are because of closure of those valves. So the first sound is when the AV valves close. That's the tricuspid on the right side and the bicuspid or the mitral on the left side. On the right side, it's also called the right AV valve for short. On the left side, it's also called the left AV valve for short. For the semilunar valves, their closure is going to be responsible for the second sound, which is the dup sound. And it's when the two valves close, which is the aortic semilunar valve closing and the pulmonary semilunar valve closing. So the aortic valve closes after blood leaves the left ventricle, and the pulmonary semilunar valve closes at the same time, and it closes after deoxygenated blood now is going to exit the right ventricle and go to the pulmonary trunk. So our image here shows us the internal anatomy of the heart. And I want to first highlight the right atrium for you, the right ventricle. So deoxygenated blood goes from the right atrium to the right ventricle. On the left side of the heart, we see the left atrium and the left ventricle. So oxygenated blood is going to go from the left atrium to the left ventricle. The valves present are the right atrioventricular valve, which is also called the tricuspid, as well as the left atrioventricular valve, which is also called either the bicuspid or the mitral valve. So those two are going to close at the same time. And when they do, that's the first sound of the heart. The second sound of the heart is when the aortic semilunar valve, as well as the pulmonary semilunar valve, close. So the aortic semilunar valve is shown right here, because freshly oxygenated blood is going to leave the ventricle, left ventricle, and go into the aorta, whereas deoxygenated blood is going to leave the right ventricle, go through the pulmonary semilunar valve into the pulmonary trunk. So we can see a lot of the other structures that are shown here, like the rest of the aorta. The first part of the aorta is called the ascending aorta, and then the aortic arch. We don't see the descending aorta because it is behind the heart. You can see a little bit of it maybe right here. And then the pulmonary trunk, it's called a trunk before it splits off, just like the branches of a tree. When it splits, it leads to the two pulmonary arteries. There's one on either side of the heart. Those pulmonary arteries are going to take deoxygenated blood, in this case, to the heart. The pulmonary veins are going to return oxygenated blood back to the left side of the heart. So we can see two of them shown here and two of them shown here. That's why it's important for you always to remember that an artery goes away from the heart. It doesn't apply to what type of blood is in the blood vessel, whether it's oxygenated or deoxygenated. Veins always go back towards the heart. This slide is showing the internal anatomy of the heart. And I want to point out the chambers for you first. We have the right atrium here, the right ventricle. On the left side of the heart, we see the left ventricle. And we really don't see the left atrium because in this view, it's kind of covered up here. There's a little bit of it shown behind that. One of the most important things for you to notice is the thickness of the left ventricle wall here. So again, the myocardium is always going to be the thickest layer, and specifically it's going to be thickest on the left side of the heart because that's where the blood pressure is highest. When we look at this image of the cadaver image, this is going to be the left atrium, so we can see it here. So it would be this area. Where I have the blue laser pointer is the left atrium. So oxygenated blood now is going to go from the left atrium through the bicuspid or mitral valve into the left ventricle. So we can see the left ventricle where I'm writing it here. This would be the right atrium and the right ventricle. So be able to identify those on a quiz or an exam. This is showing the fibrous skeleton of the heart, and in particular, it is showing you the valves. So we first want to orient our view. We can see the anterior view here, the posterior view here. And so you can see the right atrioventricular valve and the left atrioventricular valve. Remember, the right atrioventricular valve is the tricuspid valve. The left atrioventricular valve is the bicuspid valve, or it's also the mitral valve. The two semilunar valves are the aortic semilunar valve and the pulmonary semilunar valve. And so remember where blood is leaving and going to in both of these situations. So in the case of the right atrioventricular valve, blood is going from the right atrium to the right ventricle. In the case of the left atrioventricular valve, blood is going from the left atrium to the left ventricle. In the case of the aortic semilunar valve, blood is going from the left ventricle, specifically oxygenated blood, to the aorta. In the case of the pulmonary semilunar valve, deoxygenated blood is going from the right ventricle to the pulmonary trunk. For the internal view, we can see the right atrium. You've already seen where that is. That receives venous blood from the systemic circuit, specifically the superior vena cava, inferior vena cava, and coronary sinus. That blood is going to then travel through the right AV valve, which is the tricuspid valve. And these valves ensure one-way or unidirectional flow from the right atrium to the right ventricle through this opening. The right ventricle then receives deoxygenated blood from the right atrium. And what happens with these valves are there's basically what look kind of like strings called chordae tendineae. They attach muscle to the atrioventricular valve to prevent cusps from flipping into the atrium when the ventricles contract. These muscles that attach to the chordae tendineae are called papillary muscles. And those muscle projections anchor the chordae tendineae. On the left side of the heart, we see oxygenated blood flowing through it. So blood from the lungs travels through the pulmonary veins to the left atrium. And so the left AV valve, which is the bicuspid or mitral valve, is going to control flow through an opening between the left atrium and the left ventricle. The left ventricle pumps blood through the entire systemic circuit, and it generates very high pressure. This is the reason that it has the thickest myocardium. When oxygenated blood then is ejected out of the left ventricle, it goes through the aortic semilunar valve into the aorta. So again, the myocardium then in the right ventricle is not going to be as thick because it only has to generate enough pressure to pump blood to the nearby lungs. When we compare the thickness of the right and left ventricle, I want you to notice the thickness that's on the left ventricle side. So this is the left ventricular wall. This is the right ventricular wall. To give you an idea of the pressure difference, this pressure is at least 120 over 80. Usually it's much higher than that. Then it starts to decrease further away from the heart, whereas the pressure in the right side of the heart, the right ventricle, is only 20 over 10. Because it makes sense if we think about its purpose. It only has to pump blood out the right ventricle to the pulmonary trunk, pulmonary arteries, and then to the lungs. On the left side here, I want you to be able to identify the different chambers. So we can first see the right atrium here. Then below that, we can see the right ventricle. On the opposite side, we can see the left atrium, which pumps oxygenated blood into the left ventricle.